morning and welcome to another episode of Ask the Healthcare Advocate Live, where all your healthcare navigation questions are answered. And I've seen in a bunch of forums that I have been in, plus that I get questions like this all the time, but recently the difference, who I can see as a psychologist, who I can see as a psychiatrist, what am I going to get money for, what's going to be subsidized in the kupat, privately, etc. So I thought that I would take a few minutes to make order about what are the differences between them, what you are eligible for in the kupat, and how you go about taking advantage of these different services. So first of all, to explain is that a psychiatrist, who is a medical doctor who focuses in the area of mental health, who is the only medical professional who has the ability to prescribe medication for mental health issues. So SSRIs, some types of antipsychotics, sometimes of what they call benzodiazepines or some kind of more tranquilizing medications. Those are psychiatrists. So if you want to pursue, you've been either told by a therapist or by your general practitioner or whoever that might be something that works for you. So then you need to make an appointment with a psychiatrist. A GP, a general practitioner, or your rofeh mishpacha, your family doctor, can't be the one to make the initial prescription. And I just might put a caveat there that shouldn't be the one to make the prescription initially for any type of medication around psychiatric or mental health situations, because that is not their area of expertise. But a psychiatrist or a psychiater who is a medical doctor, and that is through the kupat. Meaning, just like you'd see an orthopedist, or you'd see a gastroenterologist, a stomach doctor, you'll also make an appointment for a psychiatrist. Now, there are fewer psychiatrists in the kupat than other specialties, and there is generally a lack of psychiatrists in Israel. So it could be that if you're looking for a psychiatrist, your first appointment may be several months away, which doesn't help when you're in an acute situation. So I always recommend for people, make an appointment with a psychiatrist, even if it's for 3 months away. And then you may go to a private psychiatrist, so who is outside the kupat. Most of them have private clinics. It's not somebody who you'd see through the hospital, like in other places, but a private psychiatrist who you see in their clinic. Usually you get a name that, somebody who's recommended, etc. You have to pay them privately, and it's not cheap. It's anywhere from 600 sometimes to 1,200 shekels. Now, you can check their name on the kupat, and sometimes you can get money back from them, or you can see them at a subsidized rate, the psychiatrist, but not always. So those are your options for a psychiatrist. And I say that even if you're seeing somebody privately, it behooves you to also see a psychiatrist through the kupat, because then they can write your prescriptions if you need to change dosages, etc. They can give you blood tests if you need. Some psychiatric medications need to be monitored by blood tests every 3 months. And then you can also, if you have medication that is not in the sal that you need a special permission for, they do the application for you. And the fact that they've written a prescription and done the request will help you. And a private psychiatrist cannot do that for you. So that's psychiatry. Then we have psychology, or a psycholog. A psychologist is somebody who has a master's or a PhD in clinical psychology. So they are also a doctor. However, they are not a medical doctor. They can practice either privately or publicly. When I mean by publicly, that they can have a relationship with the kupat. What do I mean by a relationship? It's different than if a specialist. It's different than if you're seeing an orthopedist or a psychiatrist or a gastro, etc. Meaning back in 2017, they call it the healthcare reform, where they put mental health, which used to be under the auspices of Misrad Habriut, of the Ministry of Health, they put it under the auspices of the kupat. So the kupat became responsible for offering those services to their customers, and they are mandated by law to give those services at a subsidized rate. So what does that mean? That means that the kupat has a contract with X group of psychologists or therapists, and we'll get to that in a second, who they have pre-approved, that they've jumped through all the hoops. They sign a contract with the kupa, and then you have a list in the kupa that you can see that you have to individually contact the psychologist. It's not like making an appointment with a doctor. You can do it through the internet. You have to call the psychologist directly, make an appointment with them, and you are therefore offered a subsidized rate, meaning 154 shekels for the initial assessment. And then, or is it, no, I'm sorry, it's 75 shekels for the initial assessment. And then it's 154 shekels each time you see them. And usually you can get 29, 30 visits is easily approved by the kupa in order to see the therapist. And then you have to request another. If you want that, you must request a hafnaya, a referral from your family doctor. And this is important. You need to get a referral from your family doctor. To see a psychiatrist, the medical doctor, you do not need to. But to get the subsidy for the psychologist, you need to get a referral from your family doctor, and then you contact the psychologist, etc. Now, the people who are approved to do therapy or to offer therapy through the kupa is usually somebody who has either a PhD in clinical psychology or somebody who has a master's but has done an extra residency in psychotherapy, that these other, like an approved course, or a licensed social worker, so a master's in social work, an MSW, but who's done the psychotherapy course. So those are the people who are working with the kupa. Now, in addition to that, there's a whole host of other people who offer therapy privately of all different types. There's your regular talk therapy. There is your narrative therapy, your play therapy for children. There's CBT, cognitive behavioral therapy. There's DBT, dialectic behavioral therapy. There's all types of different therapies, and you will see them. And those people are private practitioners, and people who are good, they often recommended word of mouth, and they are completely private. Meaning, if you want to see them, you have to pay their rates, and they can anywhere from 300 to 600, 800 shekels per session, depending on the practitioner. And those are not through the kupa, and they are not subsidized, and you cannot request a retroactive subsidy from the kupa like you would if you were seeing a private medical doctor of any specialty who had some kind of agreement with the kupa. That goes the same for a psychologist, a clinical psychologist, even if they, even if they meet the criteria for the kupa, meaning they're a clinical psychologist with a psychotherapy focus. If they don't have an agreement with the kupa, then you cannot ask for a subsidy back or retroactively reimbursement from the kupa to cover those costs. So that's important, and I wanted to really clarify that so we understand the difference between all of those different types of practitioners and therapists. So I hope that was in some way clear. As always, I appreciate your comments, feedback, questions. You can either post a comment here on the video or send me a private message. Happy to answer. And join me every Sunday morning between 8:30 and 9 as we discuss all things healthcare advocacy related.